TV 11 News.
Brianna, thank you. It's hard to remember or hard to think that it's been 5 years since this happened. We all remember what we were doing and how our lives were changing. We thought it was only going to be for 2 weeks, but it's been years.
Yeah, everything came to a halt. And Dr. Stephen Thomas from the University of Maryland joins us now. Good morning. Thank you for joining us.
Honored to be here.
Well, you know, it's one of those things where we wonder, did the pandemic ever really end? It felt like it just fizzled and people weren't talking about COVID as much.
You know, people aren't talking about it, but people are still getting sick. And let us not forget, over 1 million people died in this country, and time has been warped. So we're still on the front lines. You know, we went where people already have trust. And who would have imagined that in the black community, that was our barbershops and beauty salons.
Yeah.
And the people know, it doesn't matter how much hair you have, you're going to spend all day in a barbershop.
Right, that's right.
And so we literally turned barbershops and beauty salons into COVID vaccine sites.
Okay, and so you've been talking about that, the seriousness of the virus still. It's still very much so contagious. Are you seeing it spread as quickly as well, obviously we're not seeing it spread as quickly as we once saw it, but how is it spreading now? It's
still spreading the same way. It's an aerosol. It's airborne. But what's also spreading is the mis and disinformation. And that's what concerns me right now. While COVID is not front and center as it was, we still have people sick, and we have over 1 million people with long COVID. So the lessons need to be learned. This is the beginning, not the end.
And we're not seeing as many people go to get vaccines. Are you seeing them go?
We're seeing vaccine hesitancy increasing. And during the pandemic, we met people who were vaccine hesitant, but they showed up to our events, which felt like a party, and they got vaccinated. They left hesitant, but they got vaccinated. We didn't have to change their worldview or their political party. So we need to stay on the front lines, helping people make informed decisions.
Do you think that now we're better prepared for a health crisis than we were at the beginning of the coronavirus pandemic, or have we not gotten any better as a country?
We need a hot wash. We have not learned the lessons. And what's happening right now, we are in more trouble than we were. If we had a spread today, we would not be prepared. So I think that the mis and disinformation, the weaponization of public health needs to be part of the broader conversation.
And do you see in our lifetimes, or maybe our kids' lifetimes, another pandemic happening similar to this?
Who could have imagined? I've lived through the AIDS epidemic and pandemic, and now this. There will be more, and there will be shorter distance between them. We don't have to wait another 100 years like the Spanish flu.
All right, Dr. Thomas, thank you so much for joining us this morning. We appreciate it.